Hello my dear exam going students. I thought I will quickly cover what and all to expect for this upcoming theory exam in the September end, as have been requested by many of you. So let's get into this topic without wasting any more time, because I know you guys are very busy revising. Small disclaimer, these are all just my views which I feel is more important for this theory exam. Does not guarantee that you will get the same questions, so don't come back and fight with me saying, madam, I read only the questions you gave me and only few were asked, many were not asked. No, these are just how to tell my intuitions or my gut feelings, and seeing what was asked in the previous papers. I have tried to compile system wise what questions are more important to concentrate upon. Okay, so come on. COVID is going to be a very important topic for you guys. All right. So everything about COVID you should know as far as pediatrics is concerned. So pathophysiology, PIMS, I think is a definite question that you can expect. Okay. So pediatric inflammatory syndrome. There are multiple good, nice papers that are available out there that you can refer to. Then management of a COVID patient in ICU or a non-ICU setting. It can be either. Okay, suppose a asymptomatic patient they can ask, or a symptomatic patient they can ask. So they can ask in any way. Basically management you should know. And main drugs that are recommended for, I wouldn't say recommended, that have been tried for use in COVID. So they can ask a generalized question like that, or in the drug section of your question paper they can ask specifically about remdesivir or tocilizumab. Perinatal management, as in post delivery, breastfeeding, all of those can be asked. Personal protective equipment, hand hygiene, these are very important. I think this is also something that you can expect in your upcoming exams. Or a generalized, like a social pediatrics kind of question, like a pandemic, epidemic, what do you think of it, how do you manage, or how do you prepare for a pandemic. Those kind of like umbrella questions can be asked. Or a common question like immunization, general, your immunization schedule, how do you manage during COVID. There are multiple talks on this, so I think you can expect that. The way I have framed the questions is the most recent questions which are continuously being discussed in journals or which are being continuously discussed in lectures. Those are the things I think you have more chances of having as questions in this upcoming exam. And the concept of R0 can be asked. What I have missed out is diagnosis. So the diagnostic modalities for a COVID. So that also can be asked. I think if you read this much about COVID, you will definitely get easily 2 to 3 questions in all the 4 papers together. And I think you will be able to answer well. Next, growth and development. It's a vast area, but at least basically these questions, this developmental supportive care, approach to short stature, developmental screening test, and obstructive sleep apnea, I think this you will have to concentrate on. Rest, I think you will be able to answer if at all they ask something. These are questions that you might struggle if such a question is asked. That's why I am highlighting these. Behavioral and psychiatric disorder, see this pica, breath holding spell, anorexia and bulimia, lying, stealing, truancy, Tourette syndrome, pandas, all of them have been asked in one way or the other, and I think you should give more importance to this general topic like lying, stealing, truancy, academic performance, what to do with the poor scholastic performance. Those kind of questions, they are, it's the fashion in the recent papers. So I think this you will have to know something about, because see, rest, if it is asked at least 2 to 3 lines in each you will know to write about something, whereas lying, stealing, truancy, if something like that is asked, we will be at a loss. Okay, so prepare something and keep at least just 1 or 2 paragraphs to know what it is. Developmental and learning disorders, see, definitely you will get 1 question minimum, okay, from this set, because alternate years, alternately they keep asking ADHD and autism, ADHD and autism. Okay, so I think you should know. Autism, ADHD, developmental delay approach, dyslexia. Since they are slightly moving away from directly asking autism and ADHD and they have started asking dyslexia, I think you should concentrate on a child with language delay. I think this has got a good potential of being asked. Stuttering was a recent question, and if it is a repeat, you should know what to write on it. Nutrition, BFHI, I have also put up a video recently. I think this can be definite contender for the examiners because it's recently updated, isn't it so? So yes, you can expect that. Therapeutic enteral nutrition, again one of the recent Indian pediatrics journals, Indian Pediatrics, not Indian Journal of Pediatrics, it's Indian Pediatrics, has a very good review article on therapeutic enteral nutrition. You can go ahead and look at it. And since recently they are asking something like hidden hunger, micronutrient deficiencies, I think the related topics you should concentrate on, like food safety, security, double malnutrition. Double malnutrition is where you have obesity but also has undernutrition of certain micronutrients. You get my point. The patient is big but still deficient. So that is double malnutrition. There is also a triple malnutrition. So they can also ask that. And then it's IYCF, nutrition gap and management. See, IYCF also 2018, I think they have given recent guidelines, so they can ask that. Nutrition gap and management, I think IJPP Jan-March 2019 paper. There is a good review by Elizabeth Madam. I think that also you should go through. What is nutrition gap and how to manage. Then after that, these are all standard questions. Obese child, or how do you evaluate and manage an obese child, rickets, standard rickets management and refractory rickets approach. If you know this much, I think for nutrition you will be able to answer well. Fluid and electrolyte. See, these kind of topics you should give importance to. Why? Because the topic per se is small, but you will definitely have 1 or 2 questions out of that small topic. You get my point. Like in the autism and ADHD section, if you see, there were just 6 questions, but you can definitely expect 1 among that. So I think you should spend time on those kind of areas where you will definitely have a question from a small area. Whereas if you think of a CNS, it's such a huge topic, correct? Huge topic with hundreds of questions. And among them, yes, 3 to 5 questions will be asked, but for you to finish the CNS will take a long time. You get my point. So, if you see, there are just 10 questions in this. Hyponatremia, hypernatremia, sodium water balance, SIADH, acidosis, alkalosis, hyperkalemia, fluid electrolyte compartments and maintenance fluids. If you see, I have covered actually all the topics in Nelson. But among these, if you ask me which is most important, sodium, SIADH, acidosis also, and maintenance fluids and fluids and electrolyte compartment. Alkalosis is rarely asked and hyperkalemia is also rarely asked. So at least these questions you should know for pakka before you go to your exam, because 100% you will get these questions. Next, emergency and critical care is a very vast topic. You should mainly concentrate on approaches. See, as far as writing theory for emergency and critical care or neonatology, I think it is easy, because at least easy for me, I will put it that way, because we continuously see those patients, right? You manage those patients hands on. So there is not much that you have to sit and study for theory per se. For my exams, I did not go through much of the emergency and critical care, because those patients were whom I were managing on a day-to-day basis and I read on a daily basis. So if you have done that, if you have attended your clinics, if you have attended your wards and ICUs well, and if you have studied enough to manage those patients, you will definitely remember them during exams. You don't have to sit and study a theory book for managing your theory exams. That is how I should put. See, your triaging, approach to your coma, approach to convulsions patient, approach to encephalitis, approach to respiratory distress, shock, incessantly crying. All of these are patients that you have seen. Okay, they are not something new. Only thing you have to do is sit and think about how you are going to arrange your answers into side topics like an introduction, epidemiology, what is the pathophysiology, what are the causes, what is the effect of a coma or a convulsion on a child, how are you going to investigate and how are you going to manage. Among them, most important is the pathophysiology and causes is what I will say. If you know the pathophysiology and cause of each of this, you will know to manage the child, you will also know to manage your theory, because if you know your causes well, then you can investigate for each of the causes and you can treat for each of the causes in your theory. You get my point? So if you do not know anything, at least learn the causes. And HFNC, non-invasive ventilation, I think this is a very good question to ask, and so is ARDS. Brain death, recent days we have lots of discussion on brain death. What are the recent guidelines to pronounce a patient as brain death? So I think this is also important. And among approaches, give importance to septic shock, especially because we have the recent sepsis guidelines 2019 or 2020 only, I think. Okay, especially for pediatric patients. So I think you should know the surviving sepsis guidelines for septic shock. That's important. Poisoning, environmental hazards, again, if you have managed, you will definitely remember. Know the basic ones: OP compound, kerosene, paracetamol. And foreign body is important, because during this COVID times, most of the children are staying inside and they put things inside their mouth or nose and they end up in the pediatric practice. So pediatricians are the ones who are setting your questions, boss. So if they are continuously seeing foreign body patients, they are more prone to ask you the question on foreign body. So learn well about both GIT and respiratory tract. Next, genetics. This is another topic that is up and coming, and you can expect one question, especially on the different tests, genetic tests, multiple chromosomal microarray, there is one, there is clinical exome sequencing, there is fish, there so many things are there. Okay, so one question at least you can expect from genetics regarding the tests, or they can go for a generalized question like a genetic counseling, fetal therapy, or approach to a dysmorphic child. I think approach to a dysmorphic child also, it was given in one of the IJPP papers. If you have the journal, please go through that. IEM is very, very vast, but important to know approach to IEM and newborn screening. Both are important, both can be asked. Okay, I mean literally both can be asked during your exams. Specific IEMs give importance to phenylketonuria, galactosemia, and also Gaucher's disease. Because Gaucher's disease, IAP has come out with a recent guideline on management, so I think that can be asked in your recent papers. Neonatology, see, you should know the whole of neonatology, to be very honest, because it constitutes 25% of marks in your paper. Okay, among your 4 papers, 25% of questions are from neonatology. So if you have done well during your neonatology postings, then you should do well in your theory also. For neonatology, the things that you might need to concentrate are on the social part of neonatology, because that few of you may not be exposed to. So you should learn that. Like they can ask a generalized question like, what is the cause for neonatal mortality rate and how are the methods to prevent it? Or they can ask about a newborn action plan, Indian newborn action plan. So those sort of questions you will have to concentrate on. And for COVID, how do you manage a baby born to a COVID positive mother? Resuscitation, what should you do? Breastfeeding, how do you manage? So those kind of questions can be asked. And management part, they are giving more importance to. If you see, most of the questions are not, direct asking you to write everything about a diagnosis. They are slowly moving towards asking you approach and newer investigations and management. Okay, so that is what the recent trend is. So know about therapeutic hypothermia, amplitude integrated EEG, surfactant therapy, lesser invasive methods, minimally invasive surfactant therapy, and approaches to a child with anemia, thrombocytopenia, neonatal respiratory distress, you should know. Approach to a baby with hypoglycemia. Twice I have repeated, I am sorry about that. Then PPHN you can know. PPHN I have put because I don't know, some gut feeling that it might be asked. Then blood component therapy, yes, you should know, not just for neonatology, both for pediatrics. So they can ask in any way. One of the blood components is bound to come. Adolescent, give importance to substance abuse. Okay, physical development, SMR, I think most of you will read because it's a repeated question. But substance abuse is something that given things that we are seeing in recent news, substance abuse is a potential question. Immunology approach, yes, as I said, approach to everything. Know your approaches well, because even if a specific question is asked, you can draw from what you have learned from your approaches to put it in your paper. And specific diseases, severe combined immunodeficiency, chronic granulomatous disease, X-linked A-gamma globulinemia. These are all classical example diseases that you should know. Febrile neutropenia, yes, very important. And these two are questions that keep coming up on and off, and if asked, most of the time will be at a loss to write, because you don't actually see these patients. That important for theory. So at least know a few points about stem cell transplant and graft versus host disease. Allergy. If you guys are following the telegram group or WhatsApp or your lecture series that they are putting up, multiple lectures on allergy. So I think you can definitely have 1 or 2 questions in your papers this time. Give importance to asthma, especially under 5 management, urticaria, food allergy and allergy testing. I think among these, I strongly feel 1 question or 2 questions can be asked. Rheumatic disease, Kawasaki, because it closely resembles your pediatric inflammatory multisystem syndrome. I think Kawasaki also can be asked. Apart from that, your Hinoch-Schwann purpura, reactive arthritis and JAA are standard questions. Infectious disease again is a very vast topic. It's very difficult to just put up important questions collecting from there. So I tried to do it, but I don't know. Give importance to National Tuberculosis Elimination Program. I think this is a definite question for your exams, because this is recently updated for pediatrics and it can be asked. Not just they can ask just as a NTEP, or they can also ask you to write about specific investigations like CBNAT. They can ask you to write about IGRA, or they can ask you to write about expert RIF. They can ask the same thing in many ways, okay, because NTEP is mainly updated in your investigation, correct? So you should know everything about this. They can ask about line probe assay. Anything can be asked, especially in investigation. So go through that well. Apart from that, rest of the questions, fever without focus, CLABC, central line associated bloodstream infection, IPC is infection protection control in NICU and PICU. What are the care bundles that you have to provide in a patient who is on ventilator, who is on central lines, etc. Nosocomial infection, yes. Apart from that, these are all standard questions that you need to know. Then vaccine associated paralytic polio, vaccine derived paralytic polio. This was important because recently Africa was declared polio free and then they had outbreak because of vaccine. So yes, that you should know. Influenza candida, these are all standard questions. There is nothing more to tell in this. Give importance to National Tuberculosis Elimination Program. Gut wise, I think constipation, we have seen multiple talks. So very good chance that you can have that question. Apart from that, rest are all standard questions. Your tracheoesophageal fistula, your portal hypertension, intersusception, celiac disease, cystic fibrosis, gastroenteritis, neonatal cholestasis. These are all important. Liver biopsy was recently asked in December 2019 or June 2019, I don't remember. But if they are asking a repeat question, I think this can be asked. Respiratory system, see, easily in systems, if you see, 3 to 5 questions are asked per year. Okay, respiratory system 3 to 5 questions, your cardiovascular system anywhere from 2 to 5 questions, your CNS same 4 to 5 questions are asked per year. So give importance to the repeated questions and questions that have the potential to be asked. So as far as RS is concerned, these are all what I think is important. If you ask which is the most important, I will tell you, give importance to approaches. Okay, one of the approaches are continuously asked. One after other, some mix and match they do and they continuously ask about pneumonia, stridor, wheeze, aspiration. What do you approach or how do you approach a recurrent or a persistent case of this? So yes, you should know that. Then know about SIDS, this is important. And oxygen therapy, yeah. Rational oxygen therapy, I think this is again given in IJPP Jan March 2019. Jan, March or April, June. So go through that. It is available free and you can download it and look at it. Then radiological findings in COVID for CT, chest and X-ray, that you can look at, or just radiological investigations for diagnosing a patient with respiratory symptoms. So this sort of umbrella questions for investigations are being asked, like a diagnostic cardiac catheterization was asked earlier, right? So similarly for respiratory system also they can ask. So know about all the investigations. Then again, one more recent trend is every year they ask about one embryology question, one or two. I think latest was about hepatic embryogenesis, morphogenesis, right? So I think they can ask something else like a development of lungs. It is nicely given in most of your textbooks, different stages and what develops. Then congenital lung malformation, bronchogenic sequestration, this can be asked. Empyema, bronchiectasis, yeah, these also can be asked, but give importance to the previous questions. Cardiovascular system, again the embryology part, fetal circulation you should learn, pakka, okay. And then screening is important. Apart from that, rest are standard questions. I need not tell them again. Okay, so cyanotic spell have been asked multiple times, CCF has been asked multiple times, all of these you will know. Hematology, again give importance to approach to anemia, approach to thrombocytopenia, approach to a child who is bleeding. Give importance to ITP, transfusion therapy and hemophilia A. Okay, because these have been in multiple talks recently and they can be asked. Nephrology, again this is one other high yield area. It's a small topic, but you get 3 to 5 questions per paper. So know your approaches well. Approach to hematuria was asked recently. Approach to proteinuria can be asked. Hemolytic uremic syndrome, give importance because there is a recent IAP guideline. Okay, it's available free on IAP website. All of us can access it. Please go ahead and read it. Okay. Then renal tubular acidosis, yes. Renal biopsy, again in Indian pediatrics there is a diagnostics column in which renal biopsy has been explained. You can go through that. UTI and vesicoureteral reflex can be asked. Renal scans, I think it can be a repeat, okay, potential repeat. So these questions important as far as nephrology is concerned. Try not to miss any of these questions. Endocrine is one other small topic where 4 to 5 questions again is being asked. So I think you cannot afford to miss any of this. I'm not going to read each and every question. I think you should know about everything. Thyroid especially, read in toto. Okay, everything from your development to your production to your investigation to management of congenital hypothyroidism, I think you should know, including newborn screening for thyroidism. Okay. So learn everything about it. CNS again, it's a very vast topic. Okay, I don't know where to start or end. So give importance to approaches as usual: microcephaly, macrocephaly, floppy infant, stroke, status epilepticus, cerebral edema. Seizure mimics is a question I think can come this time along with ADEM. SMA and DMD give importance because newer treatment modalities are available for them. Febrile convulsions and neuroimaging because in recent IJPP they are highlighted with updates. Okay, so you can go through them. Yeah, this is the IJPP paper on neurology. If you see, febrile fits is there, stroke in children, ADEM, metabolic encephalopathy. So go through this paper for CNS especially, and oxygen as a prescription is also given in this. Yeah, syncope, yeah, all of these are important. Okay, so go through this paper completely. I think anything can be asked from this paper because all of them are good potential questions. Vaccination, they tend to generally go towards the general vaccination topics rather than asking about specific vaccines. Okay, specific vaccines are important for your Viva or your OSCEs, but not for your theory. Theory wise, they ask general questions like how do they store, what is immunity, vaccination immunity, adolescent vaccination, travelers, how do you vaccinate unimmunized child, combination vaccines. These kind of questions are being asked. Specific, if they are going to ask, I think it will be from these 5 because they have been in news multiple times for various reasons. So I think you should go through this. Rabies I have included because it's 2017-18 updated by WHO. Okay. Then statistics, see statistics you should know. Pakka there are 2 to 3 questions, pakka, okay. So don't miss any of the statistics questions, at least the easier ones. See, if they are going to ask something like a dot plot analysis or a histogram or some random question like that, then okay, you cannot sit and read every statistics that is out there, but basic things you should know. Like how do you define a sensitivity specificity, positive predictive value, negative predictive value, how do you know whether a study is good enough or not, how do you evaluate the significance, bias, systemic review, meta-analysis, forest plot, literature review, data collection and sources of data I have put up because multiple papers on COVID are coming up, isn't it? So they have to collect data from multiple places. That is the same reason I have put up systematic review, meta-analysis and forest plot also. Then relative risk and odds risk, evidence-based medicine, again for the same reason. So you should know your basic statistics, not advanced, if not advanced, at least basic statistics you should know. Social pediatrics again is one vast topic, but easily 2 to 3 questions, directly or indirectly they keep asking us. The recent ones are Poshan Abhiyan, the MA program, POXO, give importance to POXO. I have a very strong gut feeling that this can be asked. Vaccination program, Indradhanush, again they are accelerating, they are putting more importance to it, so that can also be asked. NTEP we discussed, human milk banking, yes of course you should know. So social pediatrics, at least these basically you should be knowing. Some miscellaneous topics that can be asked are like probiotics, probiotic microbiome, what is antibiotic dysbiosis, NRP and PALS, what are the recent updates they can ask. Then the ventilation mode of NAVA can be asked. Then clinical exome sequencing we discussed. Mortality scoring systems in NICU and PICU, which is important, which is good. So those kind of questions they can ask, and pain related also they can ask. Like what are the scoring systems for neonatal pain, pediatric pain, how do you manage neonatal pain. So those questions can be asked. Yeah. This is a direct screenshot from the IAP guidelines page. So if you see, the latest one is hemolytic uremic syndrome, umbilical cord blanking we have discussed, functional constipation we have discussed, Gaucher's disease you should know, POXO you should know, end of life care. I think this was a direct question, isn't it? So in one of the recent papers, vitamin D, then febrile child who is presenting, how do you manage, newborn hearing screening, learning disability, ADHD and ASD. So all of these questions I think you should know, because they will definitely be asked for your coming exams. So thank you guys for listening to me patiently. Again, as I said, I don't know if many of the questions will be asked, but I think I have compiled the most important from my point of view. I hope questions are asked from this set, so it helps you guys. So let us pray and hope your DNB theory exams go well. All the best. Keep me posted. Let me know if you need any other topics to be discussed for your theory exams. I will try to do them. No promises. Let's see. Bye bye.